Hello everyone, I am Ashish Pandey from First Pavlov Medical University of St. Petersburg, and today on the slide presentation I will be talking about the disease diabetes. So starting, what is diabetes then? Diabetes is a disease that affects how your body handles sugar, glucose. So it is a chronic long-standing health condition that affects how your body turns food into the energy. Most of the food we eat is generally broken down into sugar, also called glucose, and released in the bloodstream. So when the bloodstream sugar goes up, it signals the pancreas to release the insulin. Insulin acts like a key to let the blood sugar into your body cells for the use of the energy. So what happens if you have diabetes is that your body either doesn't make enough insulin or cannot use the insulin it makes, so that increases the blood sugar level. Now in the next slide I have stated the worldwide scenario of diabetes, considering the number of patients are adults between 20 to 79 years old. What is the condition is that by 2019 there has been 463 million people with diabetes condition, and it will estimated that it will increase by 51% by 2045. West Pacific region countries like Australia, China, Mongolia, Vietnam, Papua New Guinea, these countries, people have higher number of diabetic patients, 163 million, and it is supposed to increase by 31% by 2045. Similarly, Southeast Asia countries like India, Nepal, in Sri Lanka, Bangladesh, these have also higher increase of diabetes in the recent years. So in the United States, around 34 million people have diabetic condition. As you know, that diabetic condition, and it is supposed to increase 33% by 2045. In the last 20 years it has doubled, the rate of diabetes patient has doubled. Now moving to the next slide, what are the different types of diabetes we have? So the first type of diabetes is diabetes type 1. It is in this condition body doesn't make enough insulin and can develop at any age, but mostly it is seen in the young people, and it is caused by the autoimmune reaction that the body attack itself by mistake, that is stop your body from making insulin, and it consists about 5 to 10% of the population. Type 2 diabetes, it is the type in which the body doesn't use the insulin produced by the pancreas and increases the blood normal levels of blood. So about 90 to 95% of the people have this kind of diabetes. Third kind of diabetes is gestational diabetes. It happens in the pregnant women who might never had diabetes before. If you have gestational diabetes, your baby also has a higher risk of health problems, and they may have obesity and diabetes type 2 in the later future. Similar to the women also might develop diabetes type 2 in the future. Now mainly we'll be focusing on the diabetes type 2. As you know, it is the most common, 90% of the population it consists of. And what actually happens if in the diabetes type 2 is that your body or the pancreas produces the insulin, but it cannot move the blood, it cannot move the sugar in your blood to inside the cell. So in this picture I have stated how the normal pancreas or insulin works, and how in the diabetic condition. So in the diabetic condition, pancreas may produce less insulin, okay, but what actually happens is the insulin produced by the beta cell from the pancreas, they cannot carry the receptor in the insulin, it doesn't function, and it cannot carry the blood in the sugar in the blood it cannot carry, and it cannot take that inside the cell. The glucose cannot move inside the cell. As a result, it increases the blood sugar. Now what are the risk factor of diabetes type 2? Mostly there are mainly two general division of the risks. It is non-modifiable and modifiable. So there are something like family history, which you cannot change. If your parents, brother, sister have a diabetes, then you are more likely to get diabetes. if you are more than age factors matters more than 45, you are more likely to get. Race, ethnicity, male people are uh, mainly more prone to the diabetes, and mostly in United States African Americans and Hispanic Latino group are more likely to get diabetes. History of gestational diabetes, as I mentioned earlier, if you have gestational diabetes during your pregnancy, then you are more likely to get diabetes type 2 in the future. So what are the risk factors which you can actually change? It is the physical inactivity, high body fat or overweight, high blood pressure, high cholesterol level. These are things which you can change. Now moving to the diagnostic characteristic criteria of diabetes. So there are mainly four different types of method to diagnosis the diabetic condition in you. So the first one is hemoglobin. It is A1C test. It measures your average blood sugar level over the past 2 or 3 months. An A1C below 5.7% is normal, and between 5.7 to 6.4 indicates you have a pre-diabetic condition. The pre-diabetic I will be discussing in the slide to come, and 6.5% or higher indicates that you have diabetes. So next method of test for the diabetes is fasting blood sugar test. This measure your blood sugar after an overnight or not eating time period, and a fasting blood sugar level of 99 milligram per deciliter or lower is normal. 100 to 125 milligram per deciliter indicates you have pre-diabetics. And more than 126 milligram per deciliter or higher indicates you have diabetes. So the next test is glucose tolerant test. This measures your blood sugar before and after you drink a liquid that contains glucose. So you will fast, not eat overnight before the test, and have your blood draw to determine your fasting blood sugar level. Then you will drink the liquid and have your blood sugar level checked 1 hour, 2 hours, and possibly 3 hours after one. At 2 hours, a blood sugar level of 100 milligram per deciliter or lower is considered as normal. 140 to 199 milligram per deciliter indicates you have pre-diabetes, and 200 milligram per deciliter or higher indicates you have a diabetic condition. So the last test is random blood sugar test, in which you test your blood sugar level at any time, and if it is more than 200 milligram per deciliter or higher indicates that you have a diabetic condition. So there are maybe other tests which is usually done in diabetic type 1, in which the urine test is done for the ketones in your urine, and also there is antibody test for the diabetes type 1. So moving to the symptoms of we have various symptoms of diabetes which mainly include the increased thirst or polydipsia, and you always feel tired, wounds. You might get wounds and that doesn't heal for a long period of time. You might feel the sudden lose of weight. You have this polyuria, increased urination and frequent urination. You might always feel hungry. You have some problem with sex and blurry vision, and you always feel thirsty. And some of the women have the problem of vaginal infection, and in most of the patients we see numbness or tingling of hands and feet. Now, what are the complications of diabetes? It mainly affects many parts of the body, generally the kidney and the eye and the heart. But before that, people with diabetes are more likely or twice likely to get heart disease or a stroke with the patient not having a diabetic, and diabetic is the main leading role for chronic kidney disease, lower limb amputation, and adult onset blindness. So, and also smokers are 30 to 40% more likely to develop diabetes too, and they might have higher risks of getting the serious problem with diabetes. So considering the microvascular effect the diabetes type 2 has, it generally affect the blood vessels of the eyes, causing retinopathy, cataract and glaucoma. And in the kidney, high blood pressure and the high sugar level increases the small blood vessel and excess blood glucose, and it makes the overworks for the kidney and resulting in the nephropathy. And also hyperglycemia damages the nerves in the peripheral nervous system, causing neuropathy. For the macrovascular changes, it generally has, the patient with diabetes generally have higher risks of stroke and cerebrovascular disease, higher risks for coronary heart disease, and in the extremities it has peripheral vascular disease result for the narrowing of the blood vessels, increasing the risks for the reduced or lack of blood flow in the legs, leading to the gangrene or maybe amputation. Now let's little bit discuss about diabetes type 1. It is also called juvenile diabetes, usually diagnosis in the children. When your body's own immune system destroys the insulin producing cell of the pancreas, it is beta cell, then we have the diabetes type 1. Usually it is found in 5 to 10% of the people, who I said earlier. So body in this condition, we don't exactly know the real cause, but there have been studies regarding the genetics and something like weather and virus and environmental factors also trigger the gestational diabetes. So now the type 1 diabetes, sorry. So now moving to the gestational diabetes, let's discuss about how when it develops. So usually gestational diabetes develops in pregnant women who have never had diabetes before. If you have gestational diabetes, your baby could be at higher risk of having having obesity and diabetes type 2 in the future. Also, you are also supposed to have diabetes in the future. Like 50%, it is estimated that about 50% of the women with gestational diabetes goes into to develop diabetes type 2. So during pregnancy, what actually happens is your body makes more hormones and goes through the other changes such as weight gain, and these changes cause your body cells to use insulin less effectively, a condition called insulin resistance. So insulin resistance increases your body's need for insulin. All pregnant women have some insulin resistance during pregnancy. However, some women have insulin resistance even before getting pregnancy. They start pregnancy with an increased need for insulin and more likely to have gestational diabetes. So out of 818 out women usually develop gestational diabetes mellitus, and you have higher risks if you give birth to a baby higher than 9 lb. Now moving to the pre-diabetic, what is exactly pre-diabetic? Pre-diabetic is when your body sugar level increases but not high enough to be diagnosed with diabetes type 2. I have collected this data from CDC, where 86 million Americans have pre-diabetic, 1 out of 3 have diabetic condition, and 9 out of 10 doesn't know that they have pre-diabetic condition. So pre-diabetic will lead you to the diabetes type 2. Before that, there are of course some healthy lifestyle, more active life, which will help you not leading to the diabetes type 2. Now let's talk about, are you at the risk of diabetes or not? So American Diabetic Association had outlined this questionnaire to calculate your risks of getting diabetic. In this, we consider your age. Like if you are less than 40, maybe you have zero risks of getting it. And if you are 40 to 49, we put the 0.1, 50 to 59, you put 0.2, 60 years and older, you put 0.3. Now, if you are a man, you are more likely to get diabetes. So for a man, you put 0.1. If you are a woman, then if you have ever been diagnosed with gestational diabetes or not. If yes, then you put the 0.1. And if does your family history has diabetic, then again you put the 0.1. And do you have the other problem like high blood pressure? If yes, then you again add 0.1. And how is your lifestyle? Are you taking are you doing physical, are you physically active or not? If no, then you put 1 point again. And what is your body mass index like? Is it normal or high? so from that also you put the point. So if your risk is higher then 5, if your point is higher than that 5, then you are more likely to get diabetes type 2. Now, how do we prevent diabetic? Generally speaking, we will be discussing about prevention in the more slides to come, but generally speaking, it's like losing the weight, 5 to 10% of your body weight if you are overweight. So moderate exercise at least 30 minutes a day and eat a healthy lifestyle. So these are the basic method how we can actually control diabetes. Treatment method, of course, early diagnosis, patient education and medication will definitely help us for the treatment of diabetes. So before going to that, it is really important to know our ABC. It's this, ABC generally refer for the A1C, this is the glucose level in your body, B for blood pressure, and C for cholesterol. So these 3 points, blood pressure, cholesterol level, is really important for the treatment and for the even for the diagnosis of the diabetes. So this point you have to be careful, or your doctor will be monitoring these factors, your blood pressure and cholesterol and your blood sugar level, before prescribing you any kind of medicine. Now, regular care, what are the method you actually can take care on your own, which will be more discussing in the coming slide also, like your regular habit, your food habit, your the kind of vaccination you have to, insulin level, all these personal care method will be very important for your prevention and care of the diabetes. Now moving to the next slide, there have been a myth I wanted to discuss, that does exercise actually, does it help in diabetes or not? No, there has been a general study that of course diabetes in both type 1 and type 2, it is really beneficial. The exercise, it makes you fit, it will increase your insulin requirement, it will decrease the lipid level, endothelial function. Endothelial is the inner lining of your blood vessels, and it will decrease the risks of CVD, and it will decrease your blood pressure. So this in beta cell functioning. So this point is really important for managing your blood sugars. So exercise definitely helps for maintaining your blood sugar. So now moving on to the medication, here we will be discussing about different kind of medication that actually helps for the treatment of diabetes. So there is glucose absorption mechanism, and there are different disease and their site of action is different. So some drugs affect on the stomach or the glucose absorption side, some on the muscles, some on the kidney, pancreas and liver. So usually what happens, the group there are different group of medicine, for example sulfonylurea, null sulfonyl insulin group medicines like GLP-1 inhibitor. These drugs actually increase insulin these act on the pancreas and increase insulin secretion. There are drugs like metformin and the group biguanide, which increases the liver glucose production in the liver. And also there are drugs like drugs of group GLP-1 DPPIB inhibitor, which delay the gastric emptying, which delay the absorption of the glucose. And in the kidney there are sodium glucose cotransporter group drugs, which increase glucose and sodium excretion from the kidney. So here are the different group of or class of drugs, oral medication that actually helps that for the treatment of diabetes. So these are the brand names in different countries. We have a different name. So this is mainly in the US, they take glucophage for Fortamet, and other this sulfonylurea, amyral, glucotrol, Diabet, glinase. So these are the trade name, and in different countries we have the different names. So you will take the medication on the basis of your related other diseases. If you have kidney disease, maybe you will take a different kind of drugs than what other normal people take. So your doctor will prescribe you the exact medicine you need to take, exact dose you need to take, depending upon your condition and other related diseases you have. Now actually let's move to the actual method or plan of what you really as an individual can do for the treatment of diabetes or preventing the diabetes too. So the most important is meal plan, what you like to eat, schedule at what time you want to eat, what is your timetable of eating, how many calories you want to eat, what are the food that you need to avoid of eating, and what are the physical activities you do. It is really important for the treatment of diabetes. So there in this photo you see it is plate is 9 in diameter with regular size portion. This is the method called the plate method. In this what you can do is like vegetables, you put fill half with non-starchy vegetables such as salad, green beans, broccoli, cauliflower, cabbage and carrot, the half portion where it is in the green it is written vegetables. And on the 1/4 you can fill 1/4 with lean protein such as chicken, turkey, beef, tofu or eggs, and on the other quarter you can fill with grams or starchy foods such as potatoes, rice or pasta, or skip the starch altogether and double the non-starchy vegetables. So this is one of the method how we can manage your food. So carbohydrate rich food, here we go in the slide. Here we can see the different kind of food and how much their calorific value is, what kind of vegetables is good, what kind of vegetables have low calorie, what kind of dairy products you can take, and what is its glycemic index, is it healthy for you to take or how much it is necessary for you to take. So the food like fruits like apple or the canned frozen fruits, how many cups of oatmeal you can drink, the bread, one slice of. So this and the photo I have taken from the WebMed. Here has been here is a proper photo of how much food you can actually eat and what is the timetable or at what time you have to eat. So it is also important that